Bama, and my dear colleagues Jose, Dr. T. Raja and Dr. Reti Raj. I'm really overwhelmed and reminded of the saying that speeches are easy to conceive but hard to deliver. Everything seems impossible until it is done. This is the famous quote of Nelson Mandela. And BMT is one field where the challenges of every department are unique, and right from housekeeping to clinical care. So I belong to the stem cell unit where we collect stem cells, we preserve them and sometimes process them so that we give an adequate dose of stem cells for engraftment after appropriate conditioning of the patient. We have reached an important milestone of completing 1,100 bone marrow transplants, and a silent milestone which I think the chairman and the vice chair will be impressed is we have reached far out to the world, as far as California, to the east side, and to Australia towards the other side of the globe. We have reached 100 unrelated transplants. We completed 100 unrelated transplants in December 2017. Not only for our own patients, but patients who are living far off in an unknown land, who don't have a sibling, they don't have a brother or a sister, they don't have a cord blood match. Fortunately, in the Indian population, we were able to identify HLA matched donors. We collect the stem cells here and send it across to the globe to reputed transplant centers for them to do a stem cell rescue for such patients. So it's a silent milestone which I would like to bring to everybody's notice. We have a very reputed center for pediatric stem cell transplants, and we do a lot of pediatric stem cell collections. The youngest child was just 1 year old. So it's a little bit technically demanding, but we have all the help from Reti Raj, from Dr. Raja and Dr. Jose and the pediatric unit team. And every procedure goes on very smoothly, and they're able to take kids very confidently as an allogenic stem cell donor in most situations. And touch wood, there have been no flaws until now. In the diagnostic part, it is very important to classify and subtype leukemias very carefully, because it is essential to give a prognosis to the patient of how bad the disease is. So we have integrated flow cytometry and molecular diagnostics to the treatment panel so that we can risk stratify a patient on the day of diagnosis itself and say, this is what we are going to do. And flow cytometry has really helped us to identify one malignant cell in a million cells, and to say that, look here, patient, to tell the patient that you are in remission, you are in very good remission, and whether there is no residual disease or there is minimal residual disease, so that we can risk stratify your treatment. Working together works better. The phenomenal success of this unit, because all of us have stayed together for more than 15 years. Dr. Ramesh, Dr. T. Raja, Dr. Jose, Dr. Reti and myself, we completed more than 20 years of service. And this integrated approach, we know each other well, we know our shortcomings, we know what we like, what we dislike. And I think that has paved a huge way to reach this enormous milestone. And the journey will continue. The journey to fight cancer will continue, and more milestones will be reached. Thank you very much.